Prevent Blindness, Focus on Eye Health podcast with host Christopher Hord and guest Pam Gaio.
Greetings. Today we'd like to welcome our guest, Pam Gaio. Pam is a person who has dry eye syndrome. And this is a rather unique set of circumstances for people. And so she has come here to talk a little bit about her vision journey and also about her work as a vision advocate. Welcome and thank you for coming on the show, Pam.
Thank you, Chris. I'm glad to be here.
Now, first of all, to dive in, I think it's very important to sort of establish for listeners, you're in an unusual circumstance because almost everyone experiences dry eye, but almost nobody experiences it to the extent and to the constant ongoing extremes that turn it into a medical condition. So could you please talk to our listeners a little bit about your experiences, what it's like for you, and especially how you discovered that this was an ongoing medical condition that you needed treatment for?
I started suffering from this about 20 years ago, and if I attach it to anything, it's probably the start of menopause for myself. So 20 years ago, I was diagnosed pretty much at that time with chronic dry eye, meibomian gland dysfunction, bouts of uveitis, allergic conjunctivitis, blepharitis, and evaporative tears. I was treated for the most part with eye drops, and that's what my doctors said, try this, try that. I have been very lucky with my doctors as of 20 years ago. They've been pretty knowledgeable, I would say, and I hear stories of people who can't seem to find a good doctor, and that just saddens me because that's probably the most important part of the medical field for us is to find a good doctor.
Yes.
So I was given a number of treatments, and I can't begin to tell you how many I've been through, and different drops, different goggles to wear. I do have prescription glasses, and I've been wearing these for about 5 years that have moisture cup attached to it, and that's been a lifesaver for me. I mean, it's very efficient against fans and air conditioning and heating and wind and everything else that goes along with the dry eye. That's the beginning of my voyage, I would say. Before that, I took my eyes for granted until all of this happened. And then you start discovering that you better take care of them.
Yes. Now, you've mentioned how important it is to find a good doctor. Did you have experiences where you dealt with doctors who didn't understand your condition or were able to diagnose it?
No, I think the first ophthalmologist I saw, and I was living in Europe at the time, but the first ophthalmologist I saw when I was starting with these symptoms seemed to know what he was talking about and directed me towards, right away, the hot treatments once a day or twice a day or as often as needed. And he told me where to find heated goggles in Europe, and I'm still using them to this day. So I was lucky in that respect.
Now, your experiences have led you to want to advocate for people with your condition, but also in general for the blind and low vision community, but also for people to understand that even if their vision is currently fine, that they should get regular checkups and take care of their vision. Please tell us a little bit about your experiences with advocacy.
I went to Washington, D.C. last July, a year ago, which was Dry Eye Month. And I was asked to go by the Dry Eye Foundation, which is out in the Pacific Northwest. And 36 of us were there as patients with dry eye, and we went to see our legislators up on the Hill to talk to them about Dry Eye Month, what we were going through, some legislative things that had come up that we hoped they would sign off on. And I was paired up with a young woman in her early 30s who suffered already from dry eye. And I think that was a shock for some of these young staffers that we met. We told them our stories of how long we've been suffering, and each time told them that it was interesting and important for them to realize that it has no age barrier. I was surprised how many men were in our group and how many younger people. I thought that the older women who suffered from menopause and hormonal disruption were the vast majority of the dry eye sufferers, and it's not the case. There are a lot of young people, and I think there are going to be more and more with the use of screens and everything that is using our eyes nowadays. And there are young children who are suffering from dry eye. So my advocacy started last year. 2 of us from the Dry Eye Foundation took the training course this year with prevention of blindness and the aspect training within that group.
I think that's fantastic. And you make a very excellent point that I really want to emphasize. We like to talk on this program and keep people in mind that older women are a population that do experience eye conditions percentage-wise more than many groups. But eye conditions do not discriminate. There are conditions that affect people from childhood on, men and women both, and that everyone really needs to try to have as much preventative care as they can reasonably get.
Absolutely true.
Now, we talked a little bit about Prevent Blindness's Aspect program. For folks who are not familiar with it, would you tell them a little bit about what you learned in the Aspect program?
It was a fantastic experience. We were probably 50 or 60 people in the group with all different aspects of vision loss, vision problems, and I think I was the only one that had severe dry eye. And it was humbling to be in with a group and to be in a training situation with so many people who suffer from very, very serious or blindness itself. I was touched by the different aspects of the group, and I don't know how to explain what it brought to me. It was so important to be in that group, and I just thank every day that I was able to be a part of it. The training was fabulous. Participants were ever ready to put themselves out there and go beyond their comfort zone and just revel in the fact that we were all in this together.
Mm-hmm. I'm a person who went through Aspect as well, and I think you've expressed it very well. Do you feel your experiences are going to lead you on to further efforts to advocate for your condition?
In July, I'll go back for the 2nd year with the Dry Eye Foundation, and I'm looking forward to meeting with staffers and possibly senators, House of Representatives, if they're in the offices, to discuss all these important issues.
Very good. And I also do want to mention for our listeners, if you want to find out more about the Aspect program yourself, go ahead and visit our website at preventblindness.org. So while we've got you here, Pam, I would like to ask, is there anything that you wanted to mention, any particular causes that you support, or anything about your condition that people don't seem to generally know or understand that you would like to share with us at this moment?
I think the dry eye condition itself is an insidious problem. Most people think that we can just take an eye drop, put it in, and stop talking about it. I don't think we do talk about it a lot, but we live with it. And to be very clear, it's not life-threatening. In theory, it's not vision-threatening if it's taken care of. But it's life-altering, and it's changed my life in the past 20 years. For millions of people, probably 50, it's hard to tell because people are not told by the doctors what they have, or the patient maybe is not communicating clearly what his or her symptoms, but it is estimated that 50 million people suffer from dry eye just in the United States. And that's a hard figure to comprehend because I don't think younger people have maybe talked to their doctor about it yet or have been screened. It's just a large number of people, and it's going to be getting worse. The hours of screen time that we all spend is just going to, because we blink less, we're going to affect our eyes more. We're causing erosion on the cornea. It's going to be more and more people. Add more millions to that figure.
I think that's an excellent point, and thank you for making it. Thank you for being on the program, and I think with people like you advocating for the cause, that's just going to help people going forward.
I'm pleased to do it. I'm proud to do it. And I thank you, Chris, for this opportunity.
Thank you for tuning in to the Prevent Blindness Focus on Eye Health podcast. For more information, please visit preventblindness.org.